Dermatitis herpetiformis (DH) is a long-lasting skin problem that makes the skin very itchy and creates tiny blisters. It most often shows up on the elbows, knees, buttocks, and scalp. DH is not an infection. It is a sign that the body is reacting to gluten, a protein found in wheat, barley, and rye. The cause of DH is an immune reaction to gluten. When a person with DH eats gluten, the immune system makes special IgA antibodies. These antibodies travel to the skin and form small deposits, which trigger the itchy rash. People who have certain genes HLA-DQ2 or DQ8 are more likely to develop DH, so genetics also play a role. Typical signs are intense itching, a burning feeling, and clusters of tiny red bumps or blisters that look like a bunch of small hives. The rash is usually symmetrical, appearing on both elbows, both knees, or both sides of the back. Scratching can turn bumps into painful sores, and the skin may feel sore after a shower. Doctors confirm DH by taking a tiny skin sample biopsy and looking for IgA deposits with a special microscope technique called immunofluorescence. Blood tests that check for anti-TTG, IgA antibodies can also help. Treatment has two parts: a strict gluten-free diet, no wheat, barley, or rye, to stop new rash formation, and a medication called dapsone that quickly reduces itching and rash while the diet takes effect. For example, a patient who starts a gluten-free diet and takes dapsone often feels less itchy within a few days. The best way to prevent flare-ups is to avoid gluten completely. Learn to read food labels, choose gluten-free breads, pasta, and snacks, and ask about hidden gluten when eating out. Keeping the skin clean and not scratching also helps. Carrying gluten-free crackers or fruit can stop accidental gluten exposure that would trigger a rash. Recent research 2022 to 2023 shows that many patients can eventually stop dapsone if they stay on a strict gluten-free diet for several months, because skin antibody levels fall.